The team went to this rather long list of sources to fact-check his claims. A doctor with the University of Colorado Medical Campus, a University of Nebraska physician, New England Journal of Medicine, a pulmonary and critical care doctor at Indiana University Health, and the Food and Drug Administration. So here's what they found.
The first claim from Dr. Stock suggests vaccinated people are developing a more severe case of COVID than unvaccinated people. Our sources say Dr. Stock is referring to an extremely rare phenomenon called antibody-dependent enhancement, or ADE. According to the University of Nebraska physician Nada Fadul, it occurs when certain antibodies make it easier for viruses to get into cells. Now, if the COVID-19 vaccines caused ADE, Dr. Fadul says people who are vaccinated would have more severe disease. Dr. Gabriel Boslet confirms that ADE is legit, but says Dr. Stock may be misleading people by suggesting it's happening with COVID.
The hospitals are not filled with vaccinated people. The hospitals are filled mostly, almost exclusively, with people who have not had the vaccine.
So we can verify this claim as false. Vaccinated people who contract COVID-19 are not developing a more severe case than unvaccinated people. In fact, if you're vaccinated, you're more likely to get a mild case of the disease if you get infected at all. Here's another claim about vaccines from Dr. Stock.
No vaccine prevents you from getting infection.
According to the CDC, clinical trials have proven that all COVID-19 vaccines currently available in the United States are effective at preventing COVID-19. They also say research shows growing evidence that vaccines using mRNA technology, like Pfizer and Moderna, have been effective outside of clinical trials at preventing infection. But the vaccines aren't 100% effective. According to the vaccine manufacturers and the CDC, all vaccines approved for use in the United States have between a 66.3 and a 95.4% efficacy rate. Vaccine efficacy is highly dependent on how much infection is in your community, according to Dr. Coley.
So when you have high rates of infection in the community, the vaccines don't work as well. And then when the infection rates are lower, the vaccine efficacy in terms of preventing infection goes up. It's also obviously dependent on our behaviors.
So while we can verify it is true that vaccines are not 100% effective, the COVID-19 vaccines are still highly effective at preventing many COVID-19 infections. In his next claim, Dr. Stock argues vitamin D, ivermectin, and zinc can be used as a treatment plan to keep COVID-19 patients out of the hospital. So let's go through each element of that treatment plan. According to the FDA, ivermectin is approved for treating some parasitic infections as well as head lice and skin conditions like rosacea. In a statement, it said ivermectin is not approved for use in treating or preventing COVID-19 in humans. Dr. Coley said zinc and vitamin D can be used to help bulk up immune function, but there isn't scientific evidence that supports the use of those two drugs along with ivermectin to treat COVID-19. So it's false. Ivermectin, vitamin D, and/or zinc are not approved treatments for COVID-19. With your Verify, I'm Ariane Till. Next time you see a claim spreading on the internet, send it to us. You can email us or text us. And to check out more stories like this and to sign up for our newsletter, go to verifythis.com.